Would you agree with the Rand Corporation and every other independent survey that we continue to pay the highest prices in the world? You agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for the most common
I'm not saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
The most common drugs we do are GLPs, or IVF drugs, or COPD drugs, or asthma drugs for insulin.
Bernie Sanders delivered a fierce challenge to Robert F. Kennedy Jr. during a tense Senate hearing centered on vaccines, public health, and scientific evidence. Sanders confronted Kennedy over statements from his book The Real Anthony Fauci, where Kennedy questioned the role vaccines played in reducing disease-related deaths during the 20th century. Coming prepared with global health research, Sanders cited findings from a major World Health Organization and Lancet study showing that vaccines have saved an estimated 154 million lives over the past 5 decades. He emphasized that immunization programs dramatically lowered infant mortality rates worldwide and credited measles vaccines alone with saving tens of millions of lives. Sanders then directly asked Kennedy whether he still believed vaccines were not responsible for reducing infant mortality. Kennedy responded by arguing that improvements in sanitation, clean water systems, and public hygiene were the primary drivers behind the...
Secretary Kennedy, how are you? You know, in public life, we all make misstatements, all right? A couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription drugs.
For those drugs we do.
I'm sorry?
For those drugs we do, Senator.
Well, for certain drugs. But in general, would you agree with the Rand Corporation and every other independent survey that we continue to pay the highest prices in the world? You agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for the most common drugs.
I'm not saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
The most common drugs we do are GLPs, or IVF drugs, or COPD drugs, or asthma drugs for insulin.
Well, let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We pay on the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the Rand Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest prices.
All right. I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs than people in Europe or in Canada. Is that a concept that you can support?
Yes, President Trump wants this codified, and you have a lot more power than we do.
You're right. You're exactly right, and that is why I am going to be offering an amendment to the budget process right now, which would in fact codify what Trump is talking about, that the United States should not be paying higher prices than other countries around the world. Is that an amendment that you can support and get Republicans to come on board?
We will work with you, but in theory, that's exactly what we want.
All right, let me ask you another question. We're on the Health Committee. Casey Means, who is the Trump nominee for Surgeon General, was before us a while back. She agreed with me that TV ads, prescription drug TV ads in America should be banned. As you may know, we're one of 2 countries in the world. Do you agree with that?
Yes, I agree with it in theory. Constitutionally, you can't ban it, but we are now regulating it for the first time, and you'll see that The ads have changed on TV recently because we've sent out 1,000 disciplinary letters.
You may be right, but I think, the people who determine the constitutionality of laws are the Supreme Court.
Well, we worked a lot on it because I wanted to regulate it.
Okay, but bottom line is, am I hearing you correctly to say that you would like to see a ban on
Yes.
prescription drug TV ads?
Yes.
Okay, good. There are a lot of seniors in this country who right now cannot afford dental care. Many seniors have no teeth in their mouths, can't afford hearing aids. I am introducing an amendment to the budget process, which would expand Medicare to cover dental, hearing, and vision. Is that something you can support?
I'm happy to talk to you about it. I'm happy to work with you on it.
Other question. Right now, we have a diabetes epidemic in this country, an obesity epidemic. Many parents who would like to buy healthy food for their kids really can't make sense of the labeling on food products. All right? Other countries in the world are quite clear in their labeling about the amount of sugar, et cetera, that's in a product. Are you guys making any progress in coming up with simple, strong labeling on food products?
Yes, we are.
When will we see something?
Well, the delay in it has been that one of the big enemies, as you point out, obesity is costing 80% of Medicaid and Medicare dollars. One of the big problems is ultra-processed food, and there has been no federal definition or any usable definition. We've now worked out a definition. There are and here at HHS, we're in the process of going through the interagency process. There's other agencies that are Equity, USDA, Department of Commerce, OMB, and they are reviewing our regulations. As soon as we promulgate those, we already have the labeling ready to go.
Do you have any sense when that will be?
Excuse me?
Any sense when that you'll be promulgating that?
It has to go, Senator, through the other agencies that I don't have any control, but we want it to happen quickly.
Yeah, thank you.
Thank you, Mr. Chairman. So after President Trump and the Republicans slashed health care for millions of families, the president pitched his Trump RX website as the answer for Americans who are worried about health care costs. He claims that Trump RX has reduced prices by as much as 600%, which I think means companies should be paying you to take their drugs. But let's do some real math here. Take one drug, Protonix, a 30-day supply of this heartburn medication, costs $200 on Trump RX. But there is an identical generic version of this pill called pantoprazole. Secretary Kennedy, do you know how much it costs for a 30-day supply of that drug at Costco?
But I would say this, Senator.
Do you know what it costs?
President Trump has a different way of calculating. If there's two ways of calculating percentage. If you have a $600 drug and you reduce it to 10, that's a 600% reduction.
But you know I only have 5 minutes. Do you know what the drug costs at Costco?
I do not.
The drug is $16 at Costco. Trump RX charges $200 for Protonix, and Costco charges $16. Let's do another one. Pitocin is a treatment for heart arrhythmia. It costs $336 on Trump RX, or you can get the generic at Cost Plus Drugs for $12. So you tell me, Mr. Secretary, are patients better off paying $336 on Trump RX or $12 at Cost Plus Drugs?
You're comparing apples to oranges because you're comparing the brand drug to the generic drug.
Yeah, to the exact same drug.
Well, people should be buying the generic, and we will be directing
To
them
the
to generic.
exact same
Yeah,
drug.
we'll be directing them to the generic.
Tell me, Mr. Secretary, you think people ought to be paying $336 instead of $12?
Well, a lot of people, a lot of doctors prescribe the brand, so we're giving them 600% reductions on
So-
the brand. We will be directing them to the generic whenever it's available. You know,
So here's the thing. We know about brand names versus generic. It's a big pharma talking point in order to fool people into buying a more expensive drug. The generic is chemically the same. And here's the thing. If you're buying a drug on Trump RX, there is a more than 1 in 4 chance that Trump's discount is actually a price hike. And for an anti-big pharma guy, you sure don't seem worried about steering patients to more expensive drugs that are going to pad big pharma's profits. But there's more in this deal. In exchange for these scam discounts, President Trump has exempted these drug companies from his 100% tariffs. So think about that. Big Pharma makes billions of dollars in tariff relief by listing their drugs on Trump RX, and then they don't even lower the costs on many of these drugs. That is a great deal for Big Pharma. So, Secretary Kennedy, here's my question. Did you sign off on these sweetheart deals for Big Pharma, or was this all President Trump's idea?
The tariff relief is only applicable if the company has agreed to produce the drug in America. They have 1 year to do so.
Well,
And then they don't get the tariff relief, and then it is going to bankrupt them.
so you're the one who negotiated these?
Did I negotiate the deal?
You negotiated these deals. Will you make those deals available to us so we can see them?
I didn't personally negotiate them.
All right. Did your team negotiate these deals?
Yes.
Will you make those deals available to us so we can see them? A little transparency?
We will make I've already said this. I'm happy to make the deals available except for proprietary information and trade secrets, which when you
Good.
pass the IRA.
I will hold you to that, Mr. Secretary, because if these deals with Big Pharma are so great for Americans, then we should be able to see what promises have been made.
You have the power to make
Trump
this deal
RX
yourself.
is
Why don't you do
one
that?
more
Why did you?
Trump
We
scam.
did this because
Right
you
up
refused to
here,
do
I
it.
think what we've got is Trump University.
You have a lot more power to
water,
negotiate than we
Trump
do.
Steaks.
We got the
Americans
lowest
are getting
prices in
crushed
history.
by healthcare costs, and you and Donald Trump are actually making the problem worse. The American public deserves better.
The millions of
Mr.
people
Chairman.
who are using Trump RX disagree with you. I said the millions of people who are using Trump RX
They got a
disagree
better
with you.
than 1 out of 4 chance of paying more at Trump RX than they would if they went to Costco. That's not much of a deal for the American people.
Not on branded drugs.
Oh, so your answer is Americans should just not take prescription
We are
drugs? and
directing
that's the
people,
financial-
we will be directing people to the generics, to the cheapest available. But a lot of doctors prescribe the brands, and we're giving them massive reductions in the brands.
So those mass discounts
Massive.
are that people can pay
600%.
600%. They can
Yeah.
pay hundreds of dollars
Or more.
on Trump RX, or they can get it for $12 at
This is
Costco.
the second instance of the Secretary denying the public's right to know. That's all that the members on this committee have asked for.